Welcome to Life Happens, where Texans come to protect their legacy and prepare for the second half of life. Join your host, Attorney Kim Hegwood of Your Legacy Legal Care, and our weekly guest as we navigate the challenges that emerge as life happens. Now here's your host, Kim Hegwood.
Good morning and welcome to Life Happens with me, Kim Hegwood, and our very special guest today is Angie Galatas. Good morning.
Good morning.
And so your company is Medical Advocacy Group, and so we're going to talk about what you do. And you're a patient advocate. And so I think for our listeners, we should probably start with some basics and kind of work our way up. So tell our listeners, what is a patient advocate?
Well, a patient advocate, I want to start by saying anyone can be a patient advocate. Okay, people are patient advocates all the time. Could be your neighbor, could be a friend, could be your spouse, family member. What separates the group that I'm in as far as a patient advocate, we are independent patient advocates. Most of us are board certified. I am a board certified patient advocate because I feel like it's very important to know the recent laws, the insurance situations that come up and are always changing, the complexity of healthcare. So as a patient advocate, I really work with my patients and what their rights are so they can make informed decisions. So that separates us from just your neighbor or a family member being a patient advocate. And my company is Medical Advocacy Plus. And so I have started with this journey after being in the healthcare field for over 30 years as a speech pathologist.
Interesting. And so you must have started as a child. And you look very young. So I'm like, 30 years, really? You sure? And so,
Yeah. Yes.
so as part of, what we do, and we talk to clients a lot, in my practice, in my elder law practice, is we're always concerned about patient safety. And so how do you in your company help promote patient safety, and where do you, is it just home? Is it in the hospital, rehab? Kind of walk us through a little bit about the different areas.
So patient safety is a very big concern of mine. It has been for many years because I have seen a lot of medical mishaps. I don't want to say the word medical error, but mishaps is probably a better term. A lot of it is the understanding and the education that needs to be out there for the patients and for the healthcare, providers. So I help bridge that gap between the patients and the team. And I work with people like yourself to make sure that the laws are in place, especially when we're dealing with advanced care planning and what their wishes are. And I think that's very, very important because as a patient safety, I see that there are challenges with medication management, with their decision making, whether, what they want done to them when they are in sound mind, but yet maybe when they're not able to make the decisions on their own. And it's their right and their choice, and not necessarily the neighbor, the friend. And I do see a lot of occurrences that occur just mainly because of lack of knowledge or education. And it can happen anywhere from a hospital setting, like in a discharge. The patients are in a hurry to get out. They maybe have a little bit of anesthesia, hangover, we call it, when they've had anesthesia and they don't always remember. There's a large percentage of the population that don't really hear and understand everything that is said in a doctor's appointment or in a hospital, and they go home, and then that's where the breakdown occurs, and then they're readmitted to the hospital. And I also belong to a group called the Care Partner Project, which I work on a task force for them, and we set up all types of checklists and safety guidelines for patients to use. That's very helpful for anybody to just go into the organization and look.
Well, that's perfect, because just having information is phenomenal, and I'm a huge checklist fan, so that works great for me as well. And so to have those kind of things in place, and so let's kind of dig a little deeper now, and let's talk about some examples of of different types of things that you have done to really give our listeners a really good grasp for, this is why I would call Angie.
Yeah. So when it comes to patient safety, that's just one aspect of the job, but I feel like it overlaps in everything I do. So I think it's really important that I have these guidelines set up for my patients. So I'll give you a good example. I had a patient that was seen by his physician, and he was placed on some medications. Um, we noticed, though, there was changes after he went home, and then he was admitted to the hospital for COVID. And the doctors there, he was an elderly patient. He was 85, doing very well before he was admitted to the hospital. He was independent with, dressing and eating and paying his bills. And he lived with his spouse. And he went to the hospital because he was very, very confused. And the doctors were saying, "Oh, I think it's just his age." And as an advocate and knowing my client, I kept saying, "No, this is more than this is not my client. There's something going on with this patient." So they did a CT scan. They found out that there was nothing. And then they were talking about putting in a feeding tube. And again, this goes against the patient rights, okay? Because he had really regressed. And I kept saying, something is going on. This is not my patient. So I pushed for neurology consult, and we got an MRI and found out that the new medication they had placed him on before, it was a blood thinner, was causing little brain bleeds all over his brain. And that's what was causing the confusion and the downgrade of his status. So once we got him off, I talked to the neurologist, we got him off the medication. He made a complete 360, turned around, did not get a feeding tube, was able to go home independently and live with his wife again. And every time we go to the doctor, I just make sure I flag, hey, this guy cannot take blood thinners, because he does tend to go to the ER a lot. He has a couple little falls, and I just always want to make sure that no one puts back on that ever again, because it was detrimental to his health. He would have probably died in a short time. For example, this just even happened yesterday. I had a patient that worked with their estate planner and set up all of their, I call it their advanced care directives and what she wanted. And it was more about things about life support. When she can't speak for herself, she doesn't want to put on life support. Now, this patient had Alzheimer's, and she's a high functioning Alzheimer's, so she's mild. However, she's been having some stomach issues, and the doctor wants to do a CT scan. She doesn't want to do it. She just doesn't want to do anything invasive. She's 80 years old. And at this time, she's like, if I was to develop something more serious, I don't even know if I would treat it. However, that wasn't necessarily specifically stated in her advanced directives with her estate planning. So I'm trying to work with them and with her attorney to figure out how we can add an addendum to some of these things, because she tends to focus on that. And I want to advocate for her rights. And her husband is with her, and it's very stressful for both of them because he wants her to get the care. She doesn't want the care. So that's another good example.
I would think that, honestly, I think if I had Alzheimer's, I don't know that I would do anything either.
I understand. Yeah. But it could have been something as simple as, she has throughout a term pancreatitis. Her pancreas is a little bit swollen, and there could be just some things that she could change her diet. So it may not even be invasive, but if she has a fear that it could be something terrible or detrimental to her health, and she just doesn't really want to know. She's already has a diagnosis of Alzheimer's, and I think that's all she can handle. And I appreciate that and respect it.
I can appreciate that. That would be a lot for anybody to handle, having that diagnosis. And so what typical ages are your clients?
A lot of my patients or clients are elder, so 65 and above, because I do find, it's not the patient themselves. It's usually the family that reaches out to me. They'll say, I have my mother, I have my father, I'm busy working, I have a career, I have children, but I can't quite take care of my parents, and they really need a little more assistance and education and knowing, like either at their doctor's appointments or with their insurance billing or preparing them or, checking their labs. after age 65, I always go back to this medication issue because it does come up all the time. Your body metabolizes medicines differently because of your metabolism and your bone density. And so there's a lot of medications that you have to be careful. They're on the Beers list that I usually give to my patients to say, hey, these are caution drugs that we need to always check on before they give it to you. But so it's mostly the children of the parents. I do work with all ages. I have some people in their 30s and 40s that have difficult diagnosis and they need help with that, or just navigating the complexities of the healthcare because they're very busy trying to work and they can't manage all this and they don't want to depend on Google for everything.
Yeah, I can appreciate that. When my grandparents started declining, I was litigating. I had 4 teenagers in the house and making sure they were getting taken care of. So it's a lot. It's a lot. And so went through a lot of sleepless few years. And so, well, let me ask you this. Is there a particular specialty that you have, or does it matter?
Well, my specialty, because I was a speech pathologist for so long and I worked with adult neurogenic populations, and what I mean by that are patients who had strokes, traumatic brain injury, people who have Parkinson's, ALS. I did a lot of work with voice and swallowing. I worked with a laryngologist or an ENT that specializes in the throat. So I saw a lot of head and neck cancer and swallowing disorders. So that's easy for me. Everybody that goes from transitions from hospital to rehab and skilled nursing, that's my bread and butter because I know it so well. However, I'm very big dependent on preventative care. So I think, let's get to prevent it before it becomes a crisis, because that's when we get the phone calls, when you're in the crisis mode. So I really like to work with people like, hey, your labs are starting to trend this way. I don't want you to develop a chronic disease. So those are usually my younger people that haven't established a disease yet. However, they don't always know that, how to get back on track. So majority of my patients are probably over 65. However, I can work with all ages.
Perfect. So if somebody wants their own patient advocate, Angie, tell them how they find you.
They can find me. I'm on social media. So I'm on Instagram under Medical Advocacy Plus. I have a Facebook page and I'm also on LinkedIn. You can find me there, or you can find me with my name, Angie Galatas, and I'm a board certified patient advocate. And you can always email me, Angie@medicaladvocacyplus.com. And my number is 281-204-0017.
Okay, well, this is really good information for my listeners, so I appreciate it immensely. And thank you so much, and we look forward to having you on the show again soon.
Oh, thank you. It's been a pleasure. Thank you very much again.
Thanks for tuning in to this week's episode of Life Happens with Kim Hegwood. Be sure to tune in every Thursday at 10 a.m. wherever you listen to your podcast as we navigate through the challenges that emerge as life happens. The content of this podcast does not establish an attorney-client relationship or constitute attorney-client privilege, legal, medical, financial, or any other professional advice.